This is Priyanka Srinivasan presenting you your messy minds. So from this video onwards, let's talk about the personality disorders. So actually the disorders are classified under three clusters, that is cluster A, B and C. So today let's talk about cluster A disorders, and first let's discuss about the paranoid personality disorder. So the individuals who have this paranoid personality disorders actually are kind of mistrustful about their surroundings, and they are actually kind of suspicious about their surrounding beings. Like for example, if a person is standing just next to them, then they kind of doubt them, like whether they are going to harm them or what is that going to happen with them. And usually these people think that whoever is around them is just going to harm them without any cause. And also, even if the event has nothing to do with them, they actually take it personally and they think it is a personal attack. Like for example, if there is a delay in the airplane, then they actually take it personally and then they feel it like the flight has been delayed just in order to annoy that single individual. So this is how they actually take things. And also they are highly sensitive for the criticisms, and this makes it a high risk for them for the suicide attempts and some kind of violent behaviors. So when we talk about the causes about this paranoid personality disorder, it can be a kind of mistreatment in their childhood where their parents have not treated them properly, or it can also be like a childhood trauma where the child has gone through some kind of sexual abuse or some kind of mistreatment from their parents. So this can actually lead to this kind of paranoid personality disorders in their adulthood. And regarding the treatment for the paranoid personality disorder, usually the patients have no trust for anyone else apart from them, right? So it's really going to be very hard for them to seek out help, trusting a therapist. So it's going to be really very challenging for the therapist as well if the client is coming with this kind of paranoid personality disorder. But once if the rapport is built and if the trustful relationship is strongly built enough, then they go into the next level, that is the cognitive therapy. So these people actually have a kind of misjudgments about the people, right? So through this cognitive therapy, the therapist actually tries to correct all the misjudgments in their mind and clear them off. So this is about the paranoid personality disorder. Now second disorder in cluster A is the schizoid personality disorder. So the individuals who are going through this kind of schizoid personality disorder are actually socially detached, and they have a limited range of emotional response to their interrelationships. Also they have a lack of emotional expressiveness. They find it very difficult to express how they are going through, how they are feeling and what is the feeling inside them. So this is going to be really very difficult for them. And also if you see, they neither do enjoy being with someone else, nor do they have no interest as well, right? So they are somewhere in between, right? So they do not actually completely hate being with someone or completely enjoy being with someone. So this actually kind of leads to some problems in their sexual and romantic relationships too. So when we are talking about the causes for this schizoid personality disorder, it can be a kind of childhood shyness, right? And this seems to be a major precursor for developing such a disorder in their adulthood. So the treatment for this kind of schizoid personality disorder is going to be something of skill training, right? Social skills, how to build up their social skills, how to build up their communication skills. So by developing their social skills, their treatment will be complete. Now coming to the third disorder under the cluster A is the schizotypal personality disorder. So the individuals who have the schizotypal personality disorders are also socially detached, and also they have some kind of odd beliefs, and this seems to be similar to the schizophrenia. And it is also said to be like after a person has gone through schizophrenia and they have recovered, sometimes schizotypal personality disorder might develop. So if you see, these type of people actually are very much hypersensitive for their criticisms, and it's very difficult for us to convince them doing something or making them understand what it is happening around them. Sometimes they might actually experience the cognitive impairment and paranoia. They find it really very difficult to learn something new or to keep something in their mind or something to concentrate and do a task and complete it on time, right? So it's going to be really very difficult for them like this. And sometimes, very unusually, they also experience some kind of illusions, like for example experiencing someone else along with them when they are alone in the room. So this actually is very much related to schizophrenia, right? So they are actually kind of hallucinating someone else around them. So that is the main reason why the cause for this kind of schizotypal personality disorder is kind of genetic, because it just passes on through the genes and comes to them. And also there is researchers that says that there is a lack of left brain development, due to which they are finding it difficult to learn new things or keep something in their memory. So coming to the treatment, actually the antidepressants are combined with the therapies like cognitive behavioral therapy, or sometimes it can also be social skills training development, right? So along with the antidepressants, when these therapies are given, the best results are seen. So there we come to the end of this video, and I hope that you all have understood about the cluster A personality disorders. With cluster B personality disorders, I'll come and meet you all in the next episode. Until then, it's bye from Priyanka. Bye.